Pathophysiology for 5th semester students of the Faculty of Medicine. Pathophysiology. Here is a complete and detailed explanation of pathophysiology for the 5th semester. Structured systematically and in order. 1. Introduction to pathophysiology definition. Pathophysiology is a branch of medical science that studies changes in body function caused by disorders or diseases. Its main focus is understanding disease mechanisms. The relationship between organ and system disorders, and how these changes affect normal body functions. Learning objectives. Understand physiological changes due to diseases. Explain molecular, cellular, and tissue mechanisms of various diseases. Connect pathological processes with the patient's clinical symptoms. 2. Basic disease mechanisms: cellular adaptation, hypertrophy, increase in cell size in response to stress. Example: cardiac muscle enlargement in hypertension. Hyperplasia, increase in the number of cells, such as in the endometrium due to estrogen stimulation. Atrophy, shrinking of cell size due to reduced activity, nutrition, or stimulation. Metaplasia, change in cell type to another form, such as bronchial epithelium transformation in smokers. Cell injury, reversible injury, functional disturbances that can be restored, e.g., cellular swelling due to mild hypoxia. Irreversible injury, permanent damage leading to necrosis or apoptosis. Cell death, necrosis, unprogrammed cell death due to severe injury, such as in myocardial infarction. Apoptosis, programmed cell death essential for maintaining homeostasis, e.g., during embryonic development. 3. Inflammatory processes definition. Tissue response to injury involving chemical, immunological, and cellular mediators. Stages of inflammation. 1. Initiation. Activation of inflammatory mediators like histamine and prostaglandins. 2. Amplification. Recruitment of leukocytes, neutrophils and macrophages to the injury site. 3. Resolution. Termination of inflammation and tissue repair. Types of inflammation. Acute, a short-term response involving edema and neutrophils. Chronic, long-term inflammation dominated by lymphocytes and macrophages, often leading to fibrosis. Clinical symptoms: rubor, redness, tumor, swelling, calor, heat, dolor, pain, functiolasa, loss of function. 4. Hemodynamic and circulatory disorders: hypoxia and ischemia. Oxygen deficiency caused by impaired blood flow, such as in stroke or myocardial infarction. Thrombosis and embolism. Thrombosis, abnormal blood clot formation. Embolism, vessel blockage by foreign material like fat or air. Edema, fluid accumulation in interstitial tissues due to disrupted hydrostatic or oncotic pressure, e.g., in heart failure or kidney disease. 5. Endocrine system disorders: hyperfunction and hypofunction of glands. Hyperfunction. Example: hyperthyroidism due to excessive thyroid hormone production. Hypofunction. Example: hypothyroidism due to thyroid hormone deficiency. Metabolic disorders: diabetes mellitus, glucose metabolism disorder due to insulin deficiency or resistance. Cushing's syndrome, excess cortisol production. Addison's disease, adrenal hormone deficiency. 6. Cardiovascular system disorders: heart failure, the heart's inability to pump blood effectively, often due to hypertension or ischemic heart disease. Hypertension, increased systemic blood pressure due to vascular regulation disturbances. Shock, hypovolemic shock, excessive fluid loss. Septic shock, inflammatory response due to systemic infection. Cardiogenic shock, impaired cardiac pump function. 7. Respiratory system disorders: asthma, narrowing of the airways due to chronic inflammation. Pneumonia, infection of the pulmonary alveoli, disrupting gas exchange. Chronic obstructive pulmonary disease, COPD. Chronic airflow obstruction due to bronchitis or emphysema. 8. Digestive system disorders: gastritis, inflammation of the stomach lining due to Helicobacter pylori infection or NSAID use. Hepatitis, inflammation of the liver caused by viruses, alcohol, or toxins. Cirrhosis, fibrotic liver changes due to chronic damage, such as hepatitis B or C9. Nervous system disorders: stroke, impaired blood flow to the brain due to thrombosis, embolism, or hemorrhage. Epilepsy, abnormal electrical activity in the brain causing seizures. Neurodegenerative diseases, Alzheimer's disease. Cognitive decline due to brain degeneration. Parkinson's disease, movement disorders caused by dopamine damage in the brain. 10. Clinical application of pathophysiology case studies. Analysis of disease processes in real patients. Identifying the relationship between clinical symptoms, laboratory findings, and imaging results with pathophysiological processes. Therapeutic implications. Utilizing pathophysiological knowledge to determine specific therapies, e.g., anticoagulants for thrombosis. Interdisciplinary discussions. Engaging various medical fields to understand and manage diseases comprehensively. Conclusion. The pathophysiology course in the 5th semester provides a critical foundation for understanding how molecular, cellular, and organ-level disturbances affect overall body function. This knowledge is essential for analyzing clinical conditions, developing diagnoses, and designing therapeutic interventions.